Osteoarthritis. The best treatment options. Osteoarthritis is a condition that affects your joints, and makes them stiff and painful. It's sometimes called wear and tear arthritis. Osteoarthritis most often affects the joints in your body that carry weight, for example, your knees, hips, feet and spine. However, it can also affect your fingers, the base of your thumbs, elbows and shoulders, or potentially any other joint in your body. Osteoarthritis is sometimes confused with osteoporosis because the names are similar. However, they are different conditions. Symptoms of osteoarthritis. When osteoarthritis first develops, you may have some stiffness and pain in your joint. This might get worse when you move or put weight on it. As your condition develops, you may notice other symptoms. The main ones are listed below. A deep, aching joint pain. Depending on which of your joints is affected, you may find this pain spreads. For example, if you have osteoarthritis in your hip, you may have pain down the side or front of your thigh and into your buttock. This is called radiated pain. A reduction in your range of movement in the joint. This means you won't be able to move your joint into the positions you did before, or move them as far. A crunching and grinding sensation and noise in your joints when you move them. This is called crepitus. A change in the shape of your joint, with hard bony growths and soft swelling caused by extra fluid. Your joint may give way when you put weight on it. This can happen because your muscles have weakened or because your joint is less stable. There may be times when your symptoms get worse. For example, when the weather is damp or when you have been more active than usual. If you have any of these symptoms, see your GP. Diagnosis of osteoarthritis. Your GP will ask about your symptoms and will ask to examine you. He or she may also ask you about your medical history. There is no single test for osteoarthritis, and an examination is often all that is needed to diagnose the condition. Your GP may look to see if you have any bony growths and swelling and any creaking in your joint. He or she might also check how well your joint moves and how stable it is. Your GP may suggest you have an X-ray of your affected joint. An X-ray can help to show if the normal space in your joint is reduced because you have lost protective cartilage. It can also show if you have any extra bone growth around your joint or any roughening or thickening of the surface of your joint. Sometimes, calcification of the cartilage can be seen on X-ray images. This is when calcium builds up in a joint, usually your knee. It's more likely in older people who have osteoarthritis. Treatment options for osteoarthritis. There are a number of treatments that can help you to manage osteoarthritis and control your symptoms. However, there is no cure for the condition. Which treatments you're offered will depend on your personal circumstances. Your doctor will discuss these with you to help you make a decision that's right for you. Your decision will be based on your doctor's expert opinion and your own personal values and preferences. There are many things you can do to reduce the pain and stiffness in your joints, and to make day-to-day life easier. Self-help measures can help too. Reduce the stress on your joints and reduce the severity of your condition. Some of the main ones are listed below. Try to maintain a healthy weight for your height. This may mean losing excess weight because this can put more stress on your joints and make osteoarthritis worse. Exercise regularly and keep moving. Exercise can help to keep your joints working well. Pace yourself. For example, spread out any chores that need doing, rather than trying to do them all at once. Use a walking stick to ease any stress on your knee or hip joint. Wear shoes with a soft, thick, cushioned sole or use an insole. This will help to reduce any jarring. Massage the muscles around your joint to help ease pain. Use a heat pad or an ice pack to help relieve pain. Don't put either of these directly onto your skin as they may damage it or even give you a burn. Wrap them in a towel or dishcloth first. Think about making changes to your car, home or workplace to ease any stress on your joints. You may be able to get help from an occupational therapist. This is a health professional who can give practical assistance to help you manage with everyday tasks and increase your independence. Use braces or supports to keep your joints stable and provide support. Ask your GP about these. Click on the image to open our infographic of exercises for low back pain. Exercise. Researchers have been looking into whether exercise classes supervised by a physiotherapist and information sessions have benefits for people with osteoarthritis in their hip. They compared this with people who just went to the information sessions. Their results showed that people who did the exercise sessions had less pain from their osteoarthritis than those who only received information. The people who did exercise were also able to move around more easily, and their condition progressed more slowly. This meant that they were less likely to need a hip replacement operation. Ask your GP if there are exercise programs in your area. They may be able to refer you or give you information about physiotherapists who are running them. Non-surgical treatments. You may decide to try a type of pain relief called transcutaneous electrical nerve stimulation, TENS. This is an electronic device that sends pulses through your skin to your nerve endings. It interferes with the messages being sent to your brain and may help to relieve your pain. Some people with osteoarthritis find it useful, although it doesn't work for everyone. You can buy a TENS machine from your pharmacy. You could ask your physiotherapist if you can borrow one to trial before you decide to buy one. Surgery. If you have severe pain from osteoarthritis or it has a significant impact on your life, your doctor may suggest you have surgery. Which type of surgery you're offered will depend on your personal circumstances. This could be keyhole surgery or an operation to replace part, or the whole, of your affected joint with an artificial one. Your doctor will discuss these options with you to help you make a decision that's right for you. Surgery may help to ease your pain if other treatments haven't been effective for you. As with every procedure, there are some risks associated with having surgery for osteoarthritis. We have not included the chance of these happening as they are specific to you and differ for every person. Ask your doctor to explain how these risks apply to you. Complementary therapies. Many people with osteoarthritis take supplements or use complementary medicines to ease their symptoms. You might find that fish oils, such as cod liver oil, help to ease pain and stiffness. However, there is no strong evidence that they work for osteoarthritis. Glucosamine and chondroitin are two of the most commonly used supplements for osteoarthritis. Current research suggests that they don't work to reduce joint pain and they aren't recommended as treatments for osteoarthritis. However, some people with osteoarthritis do see a benefit from taking them. If you decide to take glucosamine or chondroitin, it may take up to 2 months before you will know if they work for you. There is little evidence that other therapies, such as acupuncture, are effective at treating osteoarthritis. However, acupuncture may help if you have osteoarthritis in your knee. Speak to your GP before you try a complementary therapy or herbal remedy. Causes of osteoarthritis. The exact reasons why you may develop osteoarthritis aren't fully understood at present. However, certain factors may increase your risk of developing the condition. You're more likely to develop osteoarthritis if one of your parents has the condition. You're over 50. You're overweight or obese. You have previously injured or had an infection in your joint. You have another arthritic condition, such as rheumatoid arthritis or gout.